Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Paula Muto, vascular surgeon, founder of UberDoc. Today's Kevin MD article is Give the Healthcare Dollar Back to Patients. Paula, welcome back to the show.
Oh, it's great to be here, Kevin. Thank you for having me.
All right. What is your latest article about and why did you decide to write it?
So, everybody knows my story by now. It's always about price transparency, access to care. Like all of us in the trenches, we just want to make it easy for our patients. So, the debate in Washington was raging. The government shut down over the fact that they couldn't come to terms with subsidies. But when you look under the hood to where those subsidies have gone, it's pretty disgraceful that those subsidies have not gone to healthcare. They've not gone to pay for a doctor visit. They're not going to pay for medications. They're not going into the patient's hands. They go to a variety of middlemen. And that has driven the price of care through the roof. And I think that we've come to a time that's clearly we're here where medicine happens in the home, medicine happens in a doctor's office. Medicine doesn't always happen in a fancy hospital. In fact, we operate on you, we send you home. So why is the healthcare dollar still being directed to middlemen and an industry and a sort of workflow that doesn't really correspond to how we take care of patients? Wouldn't it be better to just subsidize the patient first?
Hmm. So the narrative around that shutdown towards the end of 2025 was that the subsidies decreased the premiums for patients, and without the subsidies, the premiums for the Obamacare plans would skyrocket without those subsidies. So tell me how your narrative differs from what we read in the newspapers.
Well, if you look back, those subsidies were originally supposed to be like $180 for like a $300 premium. Those subsidies now are $3,500 for a premium that is much higher. So the subsidies cause the premiums to escalate, and it's about 10x what your employer premium went up. So the subsidies actually raised the premium. And many states that went into these, who agreed to do these Medicaid expansion, took that money and made deals with hospitals. And those hospitals said, hey, pay us, don't pay us Medicaid rates, pay us like over commercial rates.
Hmm.
So they kind of made a deal where that money, like, okay, you put a high price, we'll give a high premium, we'll give a high subsidy. But what did that do for everyone else buying insurance? All the employer-based plans, Medicaid was the floor. Now the floor became the ceiling and the premiums went through the roof. And so these subsidies were sort of like, were much more than, they really did raise the premium for everyone in a pretty large way. And then we've realized where those subsidies have gone. So much of this healthcare dollar has been spent on housing and food and shelter and childcare and stuff that isn't actually healthcare. And it would be fine if we had plenty to take care of our patients, but the reimbursement for taking care of like a breast cancer patient now is so low that most people can't afford to take care of them. So it's really a problem. So the money it's not about where the money is, it's where it's going.
Yeah. So it's almost like a vicious cycle, right? So I think that
Yeah.
the hospitals and medical entities, they're demanding rates above Medicaid, and that's increasing the cost of care, and that in effect is raising the price of premiums and thus necessitating the need for more subsidies, right? So it's almost like this vicious cycle.
Yeah, and the subsidies again, where are they going, right? Like there's so much money flowing in, you think this is great, right? Like you're going to get paid, and all these doctors would get paid, and primary cares would get paid, but we're losing primary cares.
Yeah.
We're losing independent doctors. The doctors still are having trouble, balancing their balance sheet in their offices, and are forced into consolidation. Why is that if the subsidies went up? It's sort of a logical question.
In your article, you said as much as 75% of those subsidies of the spending is going not necessarily to clinicians, but to administrative costs and management.
Absolutely, and that's well documented. This is public information. This is not stuff this isn't opinion. This is like through very, very good accounting, very good economists that have looked at this. Luckily the government is all public. You can see where every dollar is spent. You just have to spend some time to look at it. What we most doctors know is like we know where it's spent because it's not coming our way. Like we just keep getting cut. So how are these subsidies in Medicaid going up when Medicaid didn't pay us?
Mm.
In 2024, Massachusetts, we went like 4 months without payment. So it's like, where's the money?
So I know you're an independent physician, you run a private practice. Just tell me how the current environment is. Just we're speaking in the beginning of February 2026. What's the environment like today?
So 2024 was pretty bad, right? We had the Change Healthcare breach in Massachusetts. We had the bankruptcy of a major health organization, Steward, which, I was the hospital I worked at. So we kind of came out into 2025 a little bit better in the sense that it was more stability. It's still prior authorizations. There's still a tremendous amount of work. A lot of people gave up Medicare Advantage products. So a lot of patients have had access issues because there's been tremendous network restrictions now, because people are just giving up those plans that cost too much. I mean, providers and doctors are giving up those plans. So I'm seeing a lot of access issues amongst the patients. From a reimbursement standpoint, it's still it's never great. There's still mysteries of where you'd get paid and don't get paid. But for the most part, it seems to be that there seems to be a change happening, higher up, that people want to be able to make this more transparent, maybe, and keep doctors independent. I think there's a definite feeling that doctors would be better independent than consolidated.
So what's the
Um,
path going forward? I think that we always have the threat of government shutdowns. The issue about subsidies aren't going away. So what do you foresee happening in 2026 regarding this?
So it's interesting you should ask because I'm going to be serving on one of those committees. They put it in August. They said they wanted committees of frontline doctors, right, to help reshape healthcare. So I got nominated and very excited to be asked to be serve on one of these committees. So I think they're trying to reach out to get people at the table who are in front of patients. So I think that's the first thing. There's a sort of desire to bring people in
Mm.
to hear more about like how they can make changes. I think that for sure the rhetoric about moving more money to the patient makes tremendous amount of sense. Health savings accounts have only been growing. People don't understand them, but there's been some education toward it. Accountants and so forth are like now telling their, clients about health savings accounts. I think that there is a clear movement toward outpatient services. And that's just science, right? That's just like medicine. And I think that there, with that movement to outpatient services, it seems that there'll be more point of care delivery closer to home. And I don't mean just telemedicine, things like that. I mean closer to home. So I think that rural health, for example, is getting a lot of attention and funding, which will reverse this pretty bad trend where we were losing a lot of access points in rural areas. So I think there's sort of, I don't want to say that we've come back from a cliff, but I think we've sort of gone over like a curve
Hmm.
where it's just not logical anymore, and all of that requires funding. Washington, this sound bites, right? People are afraid to say 22 million people without insurance, and I think people are scared. They need to be able to have insurance. And we're not saying never have insurance, but I think some of that insurance could take a different form where, some of it is in your pocket as your savings, and some of it is for when you get hit by a truck. Like Medicare A, Medicare B. Medicare B ideally should just be a savings account.
We've been talking about just more of a direct payment, cutting out the middleman for many, many years now. I think the problem is a lot of that administration, a lot of those middle people, they are entities that are very entrenched, right? There's going to be winners and
They're
losers.
employers, Kevin.
Yes.
If you look at the map of the United States, healthcare is like the number one industry in 47 out of 50 states. Now that's not a healthy map. You need
Yeah.
to have manufacturing, agriculture, technology. There has to be other industries. And that's one of the interesting things about this is you look at the job situation. We've been pretty anemic on job growth for like the last 15 years.
Yeah.
And in the last few years, healthcare is always the curve to the right. It's growing and everything else is to the left. It's like we're basically stealing jobs from the other sectors and putting them to healthcare. So when politicians look at that, they're afraid, right?
Yeah.
Because you could affect jobs. But these jobs aren't good jobs. I'm going to say,
Yeah.
we need to repurpose some of these and go back to those other jobs. Because healthcare is putting a wage freeze.
Yeah.
It's really created a wage freeze which is what its originally intent was, right? Employer-based plans and, Truman era was a wage freeze, right? So, and we created benefits, but now these benefits are sucking the life out of these small companies and mid-level companies. And today I just read like even the biggest companies are laying off because it's so expensive to employ a person. Because once you go 30 hours, you're paying their health care. And I think that people have to sort of economically recognize that the health insurance burden is, in fact, putting a downward pressure on wages.
So if you look at a lot of cities and small towns, healthcare, whether it's hospitals or medical entities or insurance companies, they're often that city's largest employer,
Largest
right?
employer, yes.
So if we do what you propose and cut out those middle people, a lot of people are going to lose jobs, right? Even though
Well,
you said they're not good
yeah.
jobs, right? But people are still going to lose jobs, and you're right. A lot of politicians see that, and that's what makes them hesitant from doing what you want them to do. So what's the path forward here?
Let me say that rural hospitals have closed. Rural hospitals are the number one employer in a town. When that hospital closes, you lose a huge employer, right? So we've been facing this in areas around the country. That needs to stop. And those are nurses, doctors, technicians. Those are people who make a hospital workplace. That's a vital service that's required, like a fire station and a police station. So we need to make sure those are robust. What I'm talking about are the jobs that are eliminating anyway. So someone who needs to look for at a prior authorization, it's like AI is going to do that,
Yeah.
right? So those jobs are simply going to eliminate, and the insurance companies aren't upset about those because they're going to downsize their workforce too. So I think that those jobs are naturally going to disappear because there's no reason to have middlemen in a world of AI, in a world of that's transactional, in a world where the hospital is no longer the necessary stop before to get your care. And I'm not saying underfund hospitals. I'm just saying, putting more of the money in the patient's hands means that those hospitals have to be more affordable and more accessible. So I just think that you're right. There will be some, but those loss of jobs has already occurred. United Healthcare, I believe, cut their workforce by a significant amount. People are jumping on the bandwagon for like these products that will, to sort of do the managed care electronic, through AI.
So in your ideal world, let's say we do cut out the insurance middlemen and we subsidize patients directly through health savings account. In your ideal world, just from the patient perspective, give us a sense of what that scenario would look like from the for the patient.
So I think when the patient signs up for a job, they'll get a Blue Cross card, and that Blue Cross card will be for everything that occurs hospital high end. And then they'll get another their card will they'll turn it around, there'll be a chip. And that's their savings account. And what they don't spend, they get to keep.
Hmm.
And it moves forward. And people say, well, they're not going to get their care. It's like they're going to I said, no, people, first of all, people don't get extra care because that's silly. People don't say, please cut me open. I feel like I need to be treated today, right? I think though that people will be judicious and they'll say, wow, this is so much more convenient. Like I can actually go to my doctor and see them without having to go through all these millions of steps. I think that in the ideal world will decompress the system at its multiple visit level. The 90 million visits that occur do not have to gather data, go through three-way transactions, have all that data at risk. Just there's a lot of extra steps that don't need to happen. When you have the more important things that get to be managed, the chronic disease, the surgeries, the cancer treatments, those then can be more focused in, and the insurance companies can really look at that, and maybe that will alleviate some of the problems there. Because you're going to take off your plate all of these, I won't say silly, these day-to-day transactions that are very predictable. You take those, put them aside, make those cheaper to occur, and I think patients ideally will be able to take a little bit home with them in their paycheck. And that's what you want them ultimately, because they need to take more home in their paycheck to pay their mortgage and their education and all those other expenses that are being sucked away now by health insurance benefit that they don't utilize.
And what's the role of government? What's going to happen to Medicare and Medicaid in your vision?
So I'll let you know. No, no. I think, CMS, it's interesting. So, how our laws governed, you have all sorts of areas. The president can write executive orders, the Congress can pass laws, and then CMS can make regulations. I think it's like who's the one in charge. CMS, I think, has really been the one that we feel most, those regulations come to us most directly,
Hmm.
right? So the when you say the government, it's like when it comes to healthcare, there's all these moving parts. So and that was for the Affordable Care Act. You remember when they said, don't worry what's in between? There really wasn't anything in between. Everything was to be decided, to be determined by committee, to be determined by committee. So I think that Washington will, there is at least it seems to be that there's a movement they have to change because Medicare's bankrupt in 20, I think 33 or
Yeah.
36. So they kind of have to do something. And I hope it's bipartisan because I think everyone understands this is an issue that is across party lines. So I think what I'm seeing out of CMS, there has been some thoughtful change about how things are done, as opposed to just cut the doctors, right? Just cut the
Yeah.
doctors.
Yeah.
And the president himself has said fund the patient, which is remarkable, right? Like this movement toward like give the patient the dollar. Once you square and the drug companies have dropped their prices, right? That happened, because they understand people can't afford to buy their medications, and many of them don't have drug plans that can afford it. So I think whether everyone likes it or not, we're moving in that direction, because we can't continue to have this sort of clunker of a system from the 60s. You have to modernize it. Let's just say that. And I think the government understands that. The politicians don't. It's still a soundbite for them.
And I know that you are implementing your vision through UberDoc. So just tell us the difference it's made for the patients that use your service, and it's pretty much implementing what we're talking about today.
So it's been really an honor and a joy to see this model come to fruition, led by our direct primary care colleagues. Now it's going into specialty care, and more physicians understand that they have to create a seat for a patient that's direct pay, that's going to pay cash. And I think that's wonderful. With UberDoc, we are so blessed with so many great doctors across the country, more that join all the time. We've been servicing government service contracts for disabled and vets, which has been great. But our plan for 2026 is we're going to be going very heavy into the consumer now, right directly to the patient and to the doctors to say a lot of it is, here's the direct pay patient, but a lot of it is tell the doctors, please now open up a door. Your front end can handle all of your insurance patients, but we can handle your cash patients. Make it easy, convenient, simple, right? But that's who we've always been, and transparent, and so that they can begin to create those hybrid practices, right? It's like a hybrid, right? You
Hmm.
have electric and fuel,
Yeah. Yeah.
right? You have insurance, which you always need, and then you have a few patients that are hybrid, and make sure that your practice is accommodating to both. And we want to give you the tools for that. And we also have really exciting plans of giving doctors all sorts of other tools, not just in the direct pay space, but giving them sort of ways to understand AI, ways to understand some of the regenerative medicine, all the new markers that are out there. Like lots of people come to UberDoc because we have such a great relationship with doctors that we want to be able to like give our doctors the tools to become a modern doctor doing best for their patients. We are going to change our name. We've kind of been done with Uber now,
Hmm.
and we're going to be Sarah, which is really pretty. It's the name of the metal company that the Shell owned before us.
Hmm.
So it means mountain. So we're going to climb the mountain with our patients, right? And offer the view on the other side. So yeah, it's really exciting. It's a really exciting time.
We're talking to Paula Muto, vascular surgeon and founder of UberDoc. Today's Kevin MD article is Give the Healthcare Dollar Back to Patients. Paula, as always, let's end with take home messages that you want to leave with the Kevin MD audience.
Well, again, your audience is wonderful. Physicians, don't be afraid. We're here. We're all together. I think that's the one thing that we came out of this is like the physicians are all together. We have your back. We have your back all the way to Washington. And just remember, have faith that your patients will actually know how to find you. Just make it easy, and that we're going to get through this together and come out on the other side with with all of our incredible medical technology, and the next generation of young doctors, give them something to inherit.
Paula, thank you so much for sharing again perspective and insight. Thanks again for coming back on the show.
Thank you, Kevin.